Today is February 16, 2016. We're here with Don. I first did Don years ago for his knees, and we'll get to that in a moment. But he's back today because of neck issues and hip issues. And the viewer can see that I just injected a scar on his neck. When you came in, you were having significant problems with your range of motion of your neck, correct?
Yes.
And I didn't video you beforehand, and I'm sorry I didn't, but we're going to inject your neck as well, the back of your neck. Don, can you turn your head to the right and to the left? Good, that's better. And let's have you bend your head back and down. Okay, and what was it that you said in terms of the range of motion of your neck after I just did that scar on your neck?
It doesn't hurt as much when I can go further, and it doesn't hurt to the right.
Okay, and we can tell the viewer what that scar is from?
That's from a thyroidectomy, from 2 thyroidectomies.
Right.
20 years ago and 10 years ago.
And that was for thyroid cancer.
Thyroid
correct?
cancer, yeah.
And you're doing fairly well with that, although you're under observation. But
Yes.
my point is that any scar anywhere on the body can set up a disturbance.
Mm-hmm.
And that's what I'm most interested in with that. Now, we still have to do your neck because I think there's a disturbance there.
Okay.
And your neck, we didn't get down to the facet joint like I'd like. It was more above the facet joint and the muscle. Let's see you turn your head to the right, please. That's definitely better.
Definitely better.
Definitely better. Now to the left, please. And that's definitely better.
Yep.
Okay, so I'm pleased with this. Let's have you turn your head, bend your head back, and now down. Okay, very good. All right, Don, while I've got you,
Yes.
you were one of my first patients that I put on YouTube.
Mm-hmm.
We did 3 joints back then.
Yep.
That was more than 3 years ago, maybe
Right.
4 years ago.
Almost 4, yep.
We did your right hip
Yep.
and 2 knees.
Yes.
Now, the right hip I was doing with an older method,
Yes.
which came from the side of the hip here.
Yes.
Now we have a newer method that comes from the front of the hip,
Yes.
which we did today. But let's talk about your knees for a moment, because
Yep.
people ask me about long-term results.
Yes.
What happened?
Knees worked out like a charm. I haven't felt anything, a problem since. That was 3 or 4 years ago. No pain, no issues whatsoever.
And you haven't been back in 3 to 4 years?
I've been back 3 to 4 years, and the reason that I haven't had to is because, number one, you advised me it was time to get my hip replaced. Extremely objective and professional. I had it done, and that worked fine. I have no knee problems since. I'm back because my other hip started acting up, and my neck has been stiff, so I'm back again.
Thank you. I may post this?
Absolutely.
And in your case, I'm really delighted. 3 to 4 years, we didn't have to see you again for your knees, and they've done superbly.
Yes.
Is that correct?
Absolutely, yes.
So we got 2 out of 3 joints.
2 out of 3, and I'm still a happy camper, as I said in my last YouTube.
Thank you so much.
Okay.
So it's about 5 minutes after we injected your neck, and in your case, you're a big guy. I didn't quite make it down to the facet joint, which I'd like, so it was more in the muscle. And let's see what you can do now. Turn your head. Oh my God. I'm really, really impressed. You have to be as well.
Oh, yeah. Night and day.
And turn your head to the right, the other, left. And that is incredible.
I can almost do the same on both sides.
I got to tell you something. I'm really humbled.
Yes.
I see a lot of neat stuff. I'm always humble, but in your case, this was just amazing. Let's turn you to the side now.
Yep.
Bend your head back. And now touch your chin to your chest. Much easier than you could
Oh,
do
yeah.
before,
Oh, yeah.
right?
Yes, absolutely.
Okay, so this is a really good sign, and then I'll see you back when you're ready
Okay.
to come back,
Good.
okay?
Okay,
Thanks.
good. Thank you.